This presentation is on vaginitis. Vaginitis is the inflammation of the vagina that can result in discharge, itching, or pain. The cause is usually from an imbalance of good vaginal bacteria. The cause can be bacterial vaginosis, which is the most common genital tract disorder. It's characterized by a grayish white, watery discharge, as you can see here, caused by bacterial overgrowth. It can also be caused by trichomoniasis, which is a protozoa, meaning a parasite, and it's sexually transmitted and characterized by the yellowish to greenish discharge that is frothy in consistency. It can also be caused by candidiasis or candida, which is yeast overgrowth in the vagina, and it's characterized by this curdled white discharge that you see here. It can also be caused by asymptomatic STIs like gonorrhea and chlamydia, which are bacterial, and it can also be caused by menopause, which is due to decreased levels of estrogen in the body. Testing. So in the clinical setting, we typically use the vaginal swab. We particularly use SureSwab, which is acceptable through Quest Diagnostics and LabCorp. We'll generally run a vaginitis plus if we don't know what it is, and that tests for everything. Jordan suggests doing an endocervical swab to test for gonorrhea and chlamydia. The AMSTIL criteria is to diagnose BV, and for that you need 3 out of 4 of these characteristics present to diagnose BV. You can also do a urinary analysis for chlamydia and a wet mount for candida and trichomonas. With trichomonas, like we said, because it is a protozoa or a parasite, you will actually see them squiggling around on the wet mount. Okay, and is the testing accurate? According to Quest Diagnostic, the SureSwab that we use is 81% to 85% sensitive, 70% to 99% specific for differentiating these various reasons. It is important to remember that approximately 30% of women with vulvovaginal symptoms go undiagnosed. And so if you do have a client with symptoms, you need to treat those symptoms. Parameters. So basically we're looking to not find it. It's not detected, it's not supportive. With BV, we use the Nugent scoring, which takes into account the amount of good bacteria in the vagina, which is lactobacillus, versus the anaerobic bacteria, Gardnerella and bacteroides. Okay, so Jordan uses the term vaginal microbiome, and I love that saying because it indicates that our vagina is naturally diverse in bacteria and flora. And it's important to remember this in treatment, and also when we take antibiotics, we have to remember that that alters the natural flora in our body. Typically, our vagina should contain 95% lactobacilli, which are lactic acid-producing bacteria. So the following treatments here are going to be standard of care. So you'll notice that these don't contain any alternative medicine therapies, but we'll talk about those at the end. So for BV, we typically treat it with metronidazole 2 times a day for 7 days, or clindamycin, and that can be taken orally 2 times a day for 7 days. For candida or yeast overgrowth, typically treated with clotrimazole or metronidazole, and that is typically seen over the counter as Monistat. This is taken vaginally at night for 7 days. Same with turconazole, same protocol. Okay, so chlamydia. Chlamydia is a bacteria, and so it's treated typically with 1 dose of azithromycin. Amoxicillin can also be used. The important thing to remember with STDs is the treatment of the sexual partner and that they are at higher risk for other STDs, so further testing is appropriate. Okay, gonorrhea, typically treated with ceftriaxone, that's an injection, and then also the antibiotic azithromycin. The important thing here too is to test the partner, and same with chlamydia and gonorrhea, you want to retest in 3 to 6 months. Okay, trichomonas, our lovely protozoa, typically treated with a single dose of metronidazole. You can also do metronidazole twice a day for 5 days. Tindazole is also appropriate, and again, we want to treat the sexual partner. So in addition to the medicines that are prescribed for these, for vaginitis, we want to remember to recommend that our client avoid tight clothing, allow access to air, wear breathable cotton underwear and change often so they're not kept wet. Avoid sex as this can aggravate the infection and also reinfect the person. Okay, so here's some of the alternative therapies. Lactobacillus acidophilus. You want to get a good probiotic that is greater than 4 billion organisms, and that can be taken orally twice a day and also um, placed intervaginally at night for 7 days. And so that's just recolonizing the vagina and the body through the GI tract with healthy bacteria. Boric acid is particularly effective in treating yeast infection. It's seen in this product Yeast Away down here. 600 milligrams per vagina morning and night for 7 days is typical, like a typical protocol. Diluted tea tree oil suppositories and whole garlic suppositories have also been found to be effective in treating BV and Candida. Okay, so according to our Florida rule and law, as a midwife, we need to be testing for gonorrhea and chlamydia and also other STDs such as Hep B, HIV, and doing a pap smear, syphilis, all of those are included. Nothing is really included for BV or Candida, but we know that that's an important thing during pregnancy as well. Also, this is just saying that we as midwives cannot prescribe any of the medications that I listed. So in order to do so, you'll have your backup doctor prescribe them, or you may have prescribing privileges through your backup doctor. Okay, and these are my references.